So I'd like to introduce Dr. Reddy. She joined the Children's Healthcare of Atlanta team in 2011. As the clinical psychologist for Strong for Life. She helps patients and families make small but meaningful changes, giving them small wins in their daily lives to improve the health and well-being. She's an expert in weight management and is a great source of advice, and you all welcome to reach out to her. That was a plug for Strong for Life. She earned her PhD in clinical psychology in 2009 at Kent State. Then she went to the University of Florida. She was an undergraduate at University of Florida, and she received her bachelor's in science and psychology there. And then she completed a postdoc fellowship in child and adolescent psychology at Emory in 2012, and basically stayed. But she also did a postdoc internship in obesity and behavioral medicine at Duke Medical School in 2009. So I think she's very well qualified to speak on the next subject of physician weight bias. So thank you.
Thank you guys for having me. Can everyone hear this okay over there? No? Okay. How about now? It's better? Okay. I'll try not to move then too much. So my colleague Tammy Tanner, who's the nurse in our clinic, was actually scheduled to give this talk, and a lot of the slides that I'm going to use today are hers. This is really kind of her platform, so I just wanted to acknowledge that she put a lot of effort into this. But this will be a little bit of a shift from the nutrition focus. I don't have anything to disclose. But we're really going to be talking about weight bias in the healthcare setting. And so my goal is to increase our awareness of how this happens, even when we're not aware of it, and also to give you some pointers on how to improve the comfort of your patients when they come see you in your office. So bias is a natural human tendency. The goal of this talk is not to teach you how to fix your bias or to get rid of it. That is something that we all live with. We are influenced by our family's belief systems, our community, our nation, our culture. So all of these things impact the type of biases that we hold. Weight bias, particularly in our society, is one of the last accepted forms of discrimination some would consider in this society, particularly because we hold such a value on being fit, being thin, and looking a certain way. So when we think of someone who is successful, an achiever, someone who is organized or motivated, we tend to think of people that look like this. And when we look at images of people who are overweight, these are the common images that we see on the internet. So people who are dressed very casually, maybe slovenly, lazy, unmotivated. These are some of the characteristics that we have found people associate with someone who's overweight. And this has been proven in a lot of different studies through the years. And we rarely see pictures of overweight or obese individuals doing everyday kind of things, like being in a romantic relationship, going grocery shopping, leading a business meeting, gardening. So all of these images, when you try to look for them on the internet, it takes a while. And these images are actually from the Rudd Center, which is a center that focuses on food policy and weight discrimination research. So I would challenge you, if you have a few minutes in the break, you can try to just Google images of obese individuals, and you'll see kind of what I'm talking about. It's actually quite difficult to find positive images of overweight individuals. So as I was doing this talk, one of the projects that I came across was that of an artist who's from Memphis, Tennessee. Thankfully, that slide is working now because I really wanted you guys to see these images. She actually did a photo project called Weight Watchers, so W-A-I-T, not Weight Watchers like the program. And she went around the world filming herself standing in public places, but really her intention was to try and capture the expressions of people behind her that were looking at her. So you can't really see it very well on these images. I know they have to be a little bit more blown up. But she traveled to places like Barcelona, Chicago, New York, and then this picture on the right here She's in Times Square, and there's a young lady taking a picture of her boyfriend or whoever. And what you can see if you look closely enough is that he's actually looking at her sitting on the stairs there. And she says, this is actually quoted from her, she says, "I've always been aware of people making faces, commenting and laughing at me about my size. I decided to photograph myself sitting alone on the Times Square stairs to capture my solitude in a busy crowd. After developing the film, I noticed that a man was standing behind me being photographed by an attractive blonde woman. Rather than pose for her camera, he was sneering at me behind my back. 5 minutes later, at another location, another man turns his back to gawk at me while I'm photographing myself sitting at a cafe table." She took thousands of images. I was just looking up where she is now. She actually has a book of all these images that you can actually buy off her website. But it's really just an interesting insight into kind of the implicit bias that we may not even realize that we hold and how that impacts individuals. So one of the comments that we get the most from patients that come to our clinic is, "I've heard it time and time again. I need to eat less, I need to move more, and it's that simple." But they're coming to us because it hasn't been that simple. So I think this is a wonderful graphic. It's from the Obesity Society back in 2015, and the goal is not that you actually have to read all of the print on there. It's actually quite a bit. But what this graphic is showing is all of the potential contributors to obesity and really the things that maintain it. So if you look on the right side here, these are all the factors that are internal, so things like eating disorders, age-related changes, any kind of genetic issues, and then the left side is all the external factors that contribute to weight maintenance. Environmental factors, safety, ability to play outside, again, weight bias and stigma, things like that. So it is, while it might be true that obesity is maintained because we're inactive and we make poor dietary choices, a lot of these things are maintained by things that are much harder to fix. So depression and anxiety, poor coping mechanisms. A lot of our patients are using their food as a way of coping with stress. Having a lack of social support, an unhealthy family food environment, body dissatisfaction, and really low confidence in being able to change any of this. By the time they come to our clinic, they've really tried everything, and so they're feeling pretty defeated. Tammy, our nurse, who is going to give the talk today, she usually sees the patients first when they come to us, and they're more open with her, I think, just because she's a very warm person. But these are some of the comments that she's actually heard from teens. Every time I go to the doctor, I'm told I'm too fat. I have to lose weight or I will die. I'm so tired of disappointing my doctors and my family. I want to be thinner and healthier, but I don't know how to do it. I need help. I can't do this on my own. I've tried and I don't know what else to do. And then I don't think you'll be able to get my weight here at my doctor's office. The scale doesn't go up that high. I have to go to the Walmart and get weighed on the loading dock. So while these are all really, they are very strong statements, what they also tell me is that these people actually want to change. Because what I'm also hearing in a lot of these comments is this feeling of I have to do something, I just don't know what to do. And this quote is actually from the Rudd Center. It's a direct quote. I would not be calling students fat myself, but this is their quote. So for fat students, the school experience is one of ongoing prejudice, unnoticed discrimination, and almost constant harassment. From nursery school through college, fat students experience ostracism, discouragement, and sometimes violence. We hear that on a daily basis. Many of our children end up being homeschooled because they can't handle the constant teasing and bullying that goes on by peers. And I see it very early on, even the younger kids, once they start kindergarten and first grade, other children are pointing out that they're bigger than them. So how does this impact healthcare? There have been a lot of large-scale studies at this point that have looked at perceptions of quality of care and how frequently people follow up for preventive care. And what they have found is that weight bias is one of the barriers to actually getting quality care. In a survey of more than 700 women that had risk factors for heart disease, half of them reported canceling or delaying an appointment until they could lose more weight for fear of getting a lecture from the doctor. When we control for various socio-demographic factors, for example, age, education, insurance type, we still find that BMI is directly associated with delaying services for things like breast exams and pap smears. And probably most tragic about all of this is that even physicians are reporting they feel less empathic towards their overweight patients, and this can be felt by the patient. So we know that when a physician or a provider is empathic, it creates a stronger bond with the patient, and they're more likely to follow your advice, and they're more likely to be satisfied with care. And so we see that even someone's weight status can act as a barrier to actually creating a stronger bond and a stronger working relationship. So what can we do? So like I said, the goal is not to fix your bias. The goal is simply to be aware of what your bias is. This is just one of the questionnaires that's I think this one is free. There are a lot of free questionnaires out there. It's not meant that you give this to anyone. This is more of a sort of an introspective activity, but these are some of the examples of statements that you can look through and kind of answer for yourself and see either how strong that bias is or if there's certain areas you hadn't even realized that you felt a certain way. So some of the items on here, I would feel disgusted with myself if I gained weight. I have a hard time taking overweight people too seriously. Although some overweight people must be intelligent, generally I think they tend not to be. There's also, some of you may be familiar with the implicit attitudes test. It should be attitudes on there, not association. But Harvard has a wonderful website that has a list of various biases and different implicit tests you can take. They're very quick. And weight bias is just one of them. They have implicit attitudes tests about race, gender, language, religion, everything under the sun you could think of. But it's a really fun test to do, and you can do it in about 5 or 10 minutes. And it will give you information about where you fall in terms of your biases, where you fall compared to other people. So it's just kind of a fun thing to do. And then the other 3 are also some free scales that can be used to assess anti-fat attitudes. So the AAP has actually made some recommendations on how to improve the care that we give to people who are overweight or obese. And it really starts with role modeling. One of the things that always happens when you tell people you work in a weight management clinic is everyone wants to talk about it. And they will say things like, well, I don't understand why they can't just work out and eat less, and that should solve the problem. So we need to be a little bit more sensitive even when we're listening and talking to our colleagues about acknowledging how complex this problem is. And I'd like to make the distinction, a lot of times people will come back and say, well, you're just making excuses for them. If people really wanted to change, they would just do it. So I'd like to say it's not really necessarily making an excuse, but it's really trying to meet the patient where they are and address some of these other things like mental health issues, socioeconomic issues, or cultural issues. So it's not necessarily giving them a way out of doing what you want them to do or what they need to do, but really just acknowledging how hard it is and trying to help them there. We need to encourage our colleagues that shaming and blaming an individual is not the way about it. To go about it. No one likes that approach. It doesn't really work that well. We also need to be watching what language we use. So sometimes things like these kind of recommendations can seem a little politically correct. So instead of saying fat, we say overweight. Instead of talking about morbid obesity, we think about body mass index. But when you're using these words in conversation, they do have kind of a pejorative tone. So no matter who you're talking about, there is an element of judgment in those words. So the conversation does tend to go better when you're giving a patient information about their body mass index, as opposed to just saying, look, you fall on this you fall into the obese category here. So we want to be respectful. We want to keep the conversation open and flowing. And one of the ways we can do that is really just being aware of the type of language that we're using. And the same goes for the clinical documentation when we are communicating with other physicians. really trying to make it clear what we are trying to treat. And when it comes to actually speaking with patients, I know someone had mentioned motivational interviewing just a minute ago, but really this is the one of the more well-established approaches in talking with patients about weight management. Motivational interviewing is essentially, it's patient-centered, so instead of us coming into the room with our own agenda of talking about weight, it's trying to understand what the patient wants to talk about, being empathic. And this enables you to actually sit alongside the patient and work with them instead of sort of trying to pull them along with you to engage in some behavior change. And I do have a video on this, but I'm going to see if I can get through the slides first, and we have some time. We'll go back to this video. And really some logistical things that even when we were setting up our clinic, we had to address, making sure that chairs are comfortable, making sure that the toilets are reinforced. A lot of toilets that are wall-mounted are only designed to handle a certain weight limit. That would be the last place you would want to have someone have any issues with being able to go to the bathroom. So making sure that the furniture in your office is welcoming. Making sure that if you're weighing people, that it's done in a private area because people feel very sensitive about those kind of things. And also the AAP recommends screening for behavioral health issues. So there are a lot of, as I was mentioning before, emotional comorbidities of obesity. So really looking at how kids are performing in school, their mood, whether they are having any issues with bullying. A lot of times when they see the psychologist walk into the room, everyone clams up and no one tells me anything. It doesn't come out until they see the exercise physiologist and she's trying to get them to go out for recess or join a team, and then it comes out that they're very uncomfortable in their bathing suit, or they've been bullied on the team and they don't want to join again. So also trying to get at it in different ways might also be helpful. And advocate. So really just trying to create a culture of compassion for these individuals. Again, one of the surprising things to me was I was sort of expecting to have to advocate with other colleagues or staff, but I was kind of surprised when I would also have to find myself advocating for the child in the family setting. A lot of times there is weight bias within the family. They are encouraging their children to lose weight. And sometimes they go about it in ways that can be very harmful to the child. There can be a lot of comparison with siblings. Sometimes the siblings are calling each other names. So really trying to act as a voice of, here's how we can talk about this in a healthy way, instead of stigmatizing. And I'll end with a quote. This is actually Tammy's mother-in-law who says this, but I thought it was a perfect ending, so I didn't want to change it. But really the take-home message for this is the most important thing you can be is kind. So just being compassionate, understanding, even though we may have the solution or we think we have the solution for the family, which is eat less, exercise more, getting them there requires a lot of collaboration. And so we get there by actually being respectful and trying to be a little bit more sensitive to them.